I'm Dr. Cohen. If you've clicked on this icon, you'd be interested in body contouring procedures that go beyond tummy tucks or liposuction. What I'd like to discuss now are the basics of thigh lifts and arm tucks. There are people who've lost a significant amount of weight who simply have sagging skin, and liposuction alone is not going to take care of the problem. They may have excess dangling skin on their inner arms, they may have thigh droop, they may even have buttocks droop, and the only way to get rid of that is to remove excess skin. These procedures are very commonly done as an outpatient. Starting from the top down, the arm tucks can be severe, where people have massive hanging skin, or mild, where a combination of liposuction of the arms and a little bit of skin taken out with a horizontal scar tucked very nicely into the armpit work very well. Some people who have severe dangling skin will need an incision from their elbow up to their armpit along with the horizontal scar. And as I tell people, the scars are not for the faint of heart. Of everything that I do to people, those scars tend to be the worst because they go against the lines of natural tension of the body. That being said, there are people who have significant excess of skin on their arms after massive weight loss who are thrilled with that operation. The thigh lift, both for inner and outer thighs, and the back plasties and the flank plasties, where people have excess skin underneath their bra lines, on their backs, and their inner thighs, their outer thighs, will also come in and be very gratified by those areas of skin removal. Typically, the surgeries are done as an outpatient. There's not a lot of pain associated with them. They're often done in combination, and they can be combined as a total body lift with a tummy tuck. The risks and complications with all of these procedures are really the same. They include infection, bleeding, scars, as we just talked about. It depends upon where the incisions are being done, and that can be in somewhat judged by the location of your problem and also by your desires and how you wear clothes. The scars are usually aligned, and how you make scars really depends upon your genetics. Typically, we're going to use internal sutures only, so you don't have any railroad tracking, and the scars are going to heal over time, and it could take about a year to a year and a half for those scars to completely mature. Thigh lifts are specifically fraught with the complication of minor wound healing problems because in the groin crease and because of walking, the areas tend to get a higher rate of infection and separation, and in fact they can have a migration of the scar downwards in towards your leg, towards your knees rather, because of the tendency of gravity to pull down the scars. The scars are typically put in your groin crease for the inner thigh lifts, but they can move down a little bit and may require scar revision. For those people who have had massive weight loss, these procedures can be a godsend. And in the era now with gastric banding and lap band procedures and gastric bypass, we are seeing more and more people coming in for more extensive body contouring procedures. We do quite a lot of the procedures here. We do them in our HHC Medicare Approved Surgery Center. The pain, for the exception of the tummy tuck, is usually fairly limited and not a big deal in terms of recovery. I strongly urge you to contact me for my books and to speak to patients who've been through it. They're great operations all, and I enjoy doing them. So please come on in, and I'm happy to talk to you more extensively about each of the procedures as they apply to you.